Have you ever stopped to think about your tongue, its size or shape? Probably not, but believe it or not, this seemingly small detail can reveal surprising insights about your health. Subtle changes like swelling or even an unusually small tongue might be your body's way of signaling that something isn't quite right. From hormonal imbalances to rare genetic conditions, your tongue has a lot to say. Today, we are diving into how the size and shape of your tongue can act as a powerful health indicator. Let us start with the swollen tongue, medically known as macroglossia. Picture waking up one day and finding that your tongue feels larger than normal, making it hard to speak, eat, or even breathe. While it might seem unusual, macroglossia has several potential causes that shouldn't be ignored. One of the most common reasons is hypothyroidism, a condition where the thyroid gland doesn't produce enough hormones. This hormonal imbalance slows down your metabolism and causes water retention in tissues, including the tongue. If your swollen tongue is accompanied by fatigue, weight gain, or feeling cold all the time, it might be the time to get your thyroid levels checked. Another condition linked to a swollen tongue is amyloidosis, a rare disorder where abnormal protein deposits build up in the tissues. In this case, the tongue may feel unusually firm, swollen, and smooth. Imagine it as your tongue becoming like a sponge filled with excess water. It doesn't function as it should. Amyloidosis often presents with other systemic symptoms, so catching it early is the key. Genetic conditions can also play a role. For example, individuals with Down syndrome tend to have a naturally larger tongue relative to their mouth size, which can contribute to speech and feeding challenges. Another cause of rapid tongue swelling is angioedema, a severe allergic reaction. This can happen after exposure to certain foods, medications, or insect bites. Unlike other causes, angioedema is a medical emergency. If the swelling starts to block your airway, seek immediate medical attention. Now, here is a quick tip. If you are experiencing swelling in your tongue, pay attention to accompanying symptoms. Keep a journal to track triggers like new foods, medications, or stress levels. This information could help your doctor pinpoint the cause faster. On the other end of the spectrum, what happens if your tongue is unusually small? While much less common, a small tongue can also signal underlying health conditions. In some cases, the small tongue is linked to neurological disorders. For example, in Mobius syndrome, a rare condition caused by cranial nerve abnormalities, the tongue may be underdeveloped, leading to difficulties with speaking and swallowing. Similarly, microglossia, often seen in genetic disorders, can result in a tongue that is significantly smaller than normal. These conditions are usually detected early in life and might be accompanied by other craniofacial abnormalities. In adults, a shrinking tongue might be caused by muscle atrophy. This can result from prolonged disuse, neurological conditions, or autoimmune diseases that affect muscle tone. Imagine your tongue as a muscle that weakens over time without proper use or due to underlying conditions. If you notice difficulty swallowing, speaking, or other symptoms alongside a small tongue, it is time to consult a healthcare professional. Did you know that muscle atrophy in the tongue is similar to how your arms or legs lose strength after a long period of inactivity? When muscles don't get the signal they need from nerves, they gradually shrink and weakens. Now let us take a closer look at why these changes occur. For example, in hypothyroidism, the lack of thyroid hormones slow down your body's metabolism. This causes fluid retention, leading to swelling in softer tissues like the tongue. On the other hand, conditions like amyloidosis involve buildup of abnormal proteins that act like bricks in your tissues, making them stiff and swollen. In angioedema, the immune system overreacts to triggers, releasing chemicals that cause blood vessels to leak fluid into the surrounding tissues, including the tongue. This rapid swelling can be life-threatening if left untreated. Understanding these mechanisms highlight how interconnected our body systems are and why even small changes in the tongue can have significant implications. So, what should you do if you notice changes in your tongue's size or shape? Here are some quick tips. First is monitor symptoms. Keep track of other signs like fatigue, weight gain, or difficulty breathing. These can help identify the underlying cause. Second is maintain oral hygiene. Gently clean your tongue daily to prevent infections that could worsen swelling or irritation. Number third is stay hydrated. Dehydration can exacerbate tongue issues, so make sure to drink enough water throughout the day. Number fourth is consult a doctor. If the swelling or shrinking persists or if it is accompanied by difficulty breathing, swallowing, or speaking, seek medical attention immediately. Now, here is the quick reminder, always treat sudden tongue swelling, especially if it affects breathing, as a medical emergency. Call for help right away. Your tongue is more than just a tool for speaking and tasting, it is a window into your health. Whether it is swelling due to hypothyroidism, shrinking from muscle atrophy, or even an emergency allergic reaction, the size and shape of your tongue can tell you a lot about what is happening inside your body. If you found this video helpful, don't forget to like, share, and subscribe to our channel for more fascinating health insights. And here is a question for you. Have you ever noticed the changes in your tongue? What did you discover about your health? Let us know in the comments below. Your story might help others on their health journey. Stay tuned for our next video. Until next time, take care of your health and keep an eye on those subtle signs your body is sending. Thank you very much for watching.